Hi, my name is Ernest Hota. I'm the president and founder of Natural Alternatives Incorporated. Here in Monaga, we have 3 physicians and 6 practitioners that work under me that collectively we work towards the synergy and the healing and the rejuvenation of people's health. And this is a myriad of many different issues, but today we're going to take a very brief lesson to go through and talk about a common issue that many people suffer with called rotator cuff dysfunction. And sometimes so severe it requires surgery. Today we're going to approach it from the standpoint of it not being as severe as requiring surgical intervention, but something that can be addressed therapeutically. So if we look here at our client that is with us today, I'm going to actually be addressing this from the standpoint of how the rotator cuff encompasses all muscle structure that support the entire upper back, neck, even down into the arm, chest area. And really one muscle that is incredibly important here in this called the subscapularis. This muscle is almost near impossible to get to in that it anchors itself underneath the shoulder blade or in the back of the person's body and comes around and comes to the front of the shoulder underneath or diagonaling through the body. So again, therapeutically or manually, almost near impossible to get to even work that tissue. But the beautiful thing with an electroacuoscope, which is the tool that we specialize with here, using very powerful microcurrent therapies, again, setting up the pad structure so that I'm driving that juice underneath, I can actually affect those tissues extremely effectively. So people come in complaining all the time due to sports injuries, work injuries, lifestyle injuries, you name it, struggles and pain involving the shoulder, limitation of range of movement, sometimes so severe that they'll even refer to it as a frozen shoulder syndrome. These are all issues that here in our clinic we address extremely effectively with this type of therapy. And again, the ability to go in and drive microcurrent therapy through a joint in a way that you can't even accomplish in any manual technique. I could set it up so the pads are driving anterior to posterior through the joint. There's many different options. Today I chose, because of her complaints, I chose to come from the cervical spine all the way down into the arm so that I'm dealing with the entire nerve root or nerve structure that supplies this shoulder area. So again, even passing from here to here, I'm affecting tissues and cell structures, muscular, neurological, structural, skin even, that is irritated maybe from scars or injuries. That I'm treating every level of tissue that I can affect with this electrotherapy and setting up the way we did. So here are some of the common things that people come into our clinic involving rotator cuff injuries. Particularly if through range of movement or any kind of reaching above your head or going out in front of you, you notice clicking, snapping, popping, or pain. And the bigger issue is even limitation in range of movement. Very common for women to complain, for instance, something as simple as trying to reach and put their blouse on or their coat on. They'll notice pain and limitation and irritation. But the other thing that we find with rotator cuff dysfunction that is really crucial to comprehend is something that's called pain spasm cycle. So weirdly enough, when you have a rotator cuff issue, you cannot keep trying to force the range of motion, because what you do is initiate pain spasm cycle. So in other words, the more pain you get, the more spasming you get. The more spasming you get, the more pain you get. And it's kind of a vicious, never-ending cycle. So our goal when people come in here is to use techniques that we have with an electroacuoscope that don't initiate pain spasm cycle. We want to stay away from that. Sometimes medical doctors and other practitioners will even go so far as to prescribe medications to help deal with pain spasm cycle. And sometimes we've had encompass that in our clinic here to work with a physician to get that component as a part of it. But ultimately the goal is to treat this joint and restore range of movement, get a person out of a pain cycle, and do it without creating it through force and painful techniques and procedures. I tell most people, come on in here, give me 1 to 4 sessions and we'll show you how we can make a major impact or change in your pain. So again, welcome to Natural Alternatives.
Thank you for watching Wellness for Life.